Some of the pupils who put themselves forward have actually got an interest in a career in public health or in medicine or associated careers. Some are simply just very interested in the idea of health and so on. The pupils themselves are more confident. They've understood far more about health. And I think what's also important is that they've actually been able to spread that word amongst their own pupils and peers when they set up their surgery and they are available to talk to other pupils. They are probably quite helpful to pupils in the sense that they're talking to pupils who are of a similar age. Perhaps they feel they could be more honest and open. Certainly they did a presentation to the senior leadership team and they actually came to the governor's full governors meeting, and the governors were really blown away by the work that they've been doing. In fact, they involved the governors in an activity where they had mind apples, where the governors had to actually reflect on their own health. And I think that was something that was really interesting, both for the governors to see some of the work the pupils were doing, but also to actually be involved in that. And afterwards, some of the governors did say they really did step back and think about some of the things they might need to do. So I think there's been lots of benefits to both the pupils who were the champions and to the school, and I would definitely recommend the programme to others. I think the way to finish is to say that we have a very tangible outcome of our Champions programme by having our Mind Apple tree, which is in the foyer, where we had over 100 people, pupils, staff and governors, all reflect and did their own Mind Apple, which is actually hanging on our Mind Apple tree now in the front.
Why did you take the role of a youth health champion?
I chose to become a youth health champion because I knew it would be great for my future of university and college.
Because when I'm older I want to be a nurse or a social worker, and I thought it would give me good background information and help me.
I know it would give me another way of thinking about health.
To expand my knowledge in health and make changes according to that.
I took on this role because I'm interested in a future career in medicine. The Youth Health Champion programme enables me to gain qualifications such as UCAS points and Level 1 and Level 2 RSPH qualifications.
Because it is equivalent to your pass for GCSE and gives led to a lot of precious opportunity. Also, it will help on my future career because I'm thinking about becoming a doctor in future.
I took the role because I believe that it would be a good experience and would help me gain an insight on mental health and well-being, and also like other branches of mental health.
I wanted to take the responsibility and learn more about health.
What benefits have you gained?
From taking the role, I've improved my health and well-being knowledge, which made me more healthy myself.
It has helped me improve my communication skills, and I can talk to people I don't know a lot more easily. It has also increased my confidence, and I can deliver assemblies and presentations without worrying too much.
It helps me a lot on work as a team, on the presentation skill and on my speaking skill. It also improves my knowledge on health as we will receive a lot of training.
I have gained presentation skills, confidence and a chance to give back to the community.
I've gained lots of knowledge on how to help people and about health too.
I have gained organisation skills and how to speak in front of different people.
Why would you recommend being a YHC?
Because it lets you undertake your challenges, and it helps you be more confident in front of other people.
I would recommend you to become a youth health champion because it gives you the chance to help others in need.
I recommend it because it opens up new opportunities for training in many different subjects, and it helps you gain awareness of your own health and how to improve it.
What has been the best thing about the programme and the role?
The best thing about the YHC programme is being able to help others with issues they come to us with and receiving a lot of training.
The fun activities like planning carousel days and assemblies.
I think the best bit was you get to plan activities and you also get to meet different people from different organisations in our borough.
I think the best thing about it is to access information and guide people to where they need to go.
I think the best bit about the role and the training was during the training days. So then when we put it into practice, it was useful because we had all the prior knowledge.
The biggest challenge was completing our Level 2 portfolios, as it took quite a long time.
I faced talking in front of large crowds and people I do not know, and talking in front of strangers.
The biggest challenge I think I faced was standing up at the town hall and giving a speech to health professionals.
What advice would you give to anyone interested in becoming a youth health champion?
they should become a youth health champion because it will give them great qualifications for their future career.
My advice would be make sure everyone knows you are a youth health champion and make the most out of all the training you get.
You should take the role because I find it really helpful and I feel more confident on presenting and talking to my peers.
If you're thinking about being a YHC, my number one advice is to go for it, as I believe that it's an amazing opportunity that could open up many career paths in your life.
You have to be able to be committed and willing to give up your own time.
I've really noticed the impact of the YHCs taking part in C-card training. They were able to reach out and guide some of their peers that may not have come directly to me. The YHCs gave information and then referred them to see me, whilst ensuring confidentiality and acting in a mature manner.
I think there's more of a community feel. There's an increased confidence amongst the YHC members and also the students within the school. They feel safe knowing that there are students of their own age that they can go and share their issues with, that they may not necessarily feel comfortable when speaking to members of staff. I noticed that a lot of those pupils have an increased confidence, they're mature, they have a presence around the school, they're taking part in topics or issues or programmes that they would never have done so before, such as the Duke of Edinburgh Award. Many of those pupils have gone on to do that. They've been helping out at summer fairs, they help out at parents' evenings. Many of them have now gone on to become prefects within the school. And also we had a specialist tea where we had the elderly people that came in, and so many of those members were able to help them, serve them tea and just have a good time with them. I think year 10 and 11 pupils would be most suited because of some of the difficult and sensitive issues that are discussed, like sex education and sexual health. I think you need to be able to be mature, you need to have a mature and positive attitude when dealing with those topics.